Hello, everyone. My name is Ann Gergen. I'm the Executive Director here at AGRiP, and I'm going to run through in the next 20 minutes or so an update about public entity pooling. So we're going to start talking about property line of coverage, property claims, property losses, and the resulting reinsurance market. Really what we're talking about here is increasing frequency and severity of wildfire, but also other weather patterns and other kinds of storms, convective storms, water intrusion. So we talk about really the three W's, right? Wind, wildfire, water as being the biggest influences in the property line of coverage. So we again are seeing higher frequency, higher severity of these storm and wildfire losses. Now, the thing about pooling, of course, is that it is in most cases state or province specific. So there is that concentration of property risk. So at the same time that every event is local, meaning that if you are the pool experiencing that particular claim event among your membership, maybe it's going to hit multiple of your members all at the same time, that concentration of risk. But alongside of that, every event being local, at this point, no event is local, meaning that we are now together as an industry facing some of the ramifications of storms or wildfires that have taken place, maybe even outside of the state that our own pool exists. Really what we're saying there is that these losses are having a big impact on the reinsurance market, which is in turn driving some further changes. So when we talk about the reinsurance market, certainly we talk about increasing cost, right? Both premium and also increasing retention. So pools retaining more of the risk, paying more for the reinsurance or excess insurance that they're buying. We also know that the industry is facing some decreased reinsurance limits, either specific limits, aggregates, sublimits, etc. So again, pools facing increased retention, increased pricing, but also in some cases decreased limits by a notable margin. And then really for the first time in many, many years, we're seeing that reinsurers, excess insurers are placing some reinsurance underwriting restrictions on the pools that they partner with. So maybe at this point, the reinsurer is restricting the pool in terms of the new members that it can write, or addition of members without getting approval from the reinsurer first. So we're seeing all of those things happen in the reinsurance market right now. As a result of the underlying loss trends of the reinsurance market changes, we're starting to see some corresponding changes being made by pools to or for their member coverage as well. So maybe the pool is passing along some of those new limits, reduced limits or sublimits from the reinsurer to their members. Of course, it might also be impacting membership expansions. So those underwriting restrictions that I mentioned may be serving to limit the way that a pool is expanding its membership or expanding the limits it offers its membership. In some cases, we are seeing pools make some coverage changes as a result of what's happening in the underlying property losses and also what's happening in the reinsurance market. And I think maybe the prime example of that is a pool taking a look at aesthetic impairment exclusion language, meaning that it is excluding from coverage damage to property that is purely aesthetic. So for instance, hail pitting on a roof might be excluded from coverage. And then finally, as a result of all of these things, we're seeing pools really look more toward investment and risk management. So in some cases, that might be things like water intrusion technology or building sensors that could be put in place to sense if there's water, if there's a temperature change, for instance, in a building, municipal building. And the other thing in terms of risk management is we see some pools looking at new ways to help their members harden their properties. So are there things we can do about surrounding vegetation? Are there things we can do about building materials that are going to be fire prevention or retard the fire instead of fueling it along the way? I want to next address the liability line of coverage. And really, when we talk about liability, I'm going to talk about the liability landscape before I talk about liability losses, because on a broad basis, some of these landscape issues are perhaps more meaningful for pools and pool members. One of the things we know for certain is that there is an increasing number of attorneys who are specializing in bringing certain kinds of claims, like a sexual abuse and molestation claim, against public entities. So we know from some of our pool members that have really faced a number of these SAM claims that the majority of those claims are being brought by just one or two plaintiff attorney firms. So we're seeing that increasing attorney specialization, bringing claims against public entities. In some cases, that's further fueled by nonprofit organizations like the Innocence Project, which really is serving a public purpose, but that is also in many cases bringing lawsuits against public entities that belong to pools. Together, sort of that increasing specialization from the attorneys, the increasing awareness around issues like wrongful incarceration also feed into what many pools perceive as an increasing claims culture, the likelihood that they are facing more claims for wrongful actions of all varieties. We know that social inflation is very, very real within the public entity sector. Maybe that's tied to some of those perceptions about local government, but we know that pools are facing increasing costs, not just to defend, but actual increasing settlement costs or verdict costs as well. And then one of the big landscape changes, legal landscape changes that pools face is legislative changes like extended statute of limitations for some claims, as well as continued erosion of tort caps and of other protections. Qualified immunity has been a particularly big area of focus in the last year or so. So that's all legal landscape sorts of issues. Now, along with those legal landscape issues, there are, of course, the underlying loss trends and loss issues that pools and their members are facing. And really here I would point to three primary areas of development or three primary areas of focus. The first is cyber liability. So here we see intrusion for ransom. We see fraudulent instruction is really the biggest liability consideration. Now, the thing about cyber risks or cyber claims is that as a pool, you probably don't see a lot of these claims until you see a lot of these claims. So we hear from pools, hey, you know, I had only one or two cyber claims. And then the next year I had 3 or 4. And then the next year I had 8. And now this year I have 15. So it's that exponential growth in cyber claims that really has pools paying attention. Also, the value of demands or the value of those claims is increasing. So when we see a ransomware claim, for instance, instead of a $5,000 demand, now maybe it's a $15,000 demand. So if the pool is covering those kinds of claims for members, that's an automatic inflationary increase in those ransomware claims. And then also, of course, playing into the cyber risk, cyber liability equation are considerations just about the size and sophistication and the ability of smaller public entities to really invest all of the resources that they would need to in order to prevent those claims. And that isn't a matter so much of, you know, ability, as ability meaning concentrated ability, as it is ability meaning there are tough financial decisions that have to be made, and this may not be where a local public entity chooses to spend the majority of its funds. Now, from a sexual abuse and molestation perspective, the main concern here are those older claims. So we're not seeing pools that have a high number of recent SAM claims, but because of that extended statute of limitations, maybe retroactively in some cases, pools are facing a higher number of very old claims that they still have to manage in today's environment. So sex abuse and molestation claims, tend to be focused not just adult or teacher to student, but also student to unstudent. And again, very much the focus are those older claims just now coming to light. Law enforcement and corrections claims. There are a lot of emerging questions around this particular liability loss area. Certainly we know that the last several years have been really troubling and a struggle in many communities, but now we have state and federal legislation around police accreditation, around police mandates, around police reform. We have local decisions being made about different ways to fund traditional police activities and what that might look like, how that might change the liability landscape. We've got questions about personal liability for law enforcement officers. We've got that qualified immunity question that I mentioned in legal landscape. So really from a law enforcement and corrections perspective, there are so many potential influences right now. The claims are just one piece of this puzzle. How those claims come together in this shifting legal landscape and with these different reform conversations going on is really the bigger question. And perhaps even a larger question, larger looming question, is a question about recruiting and retaining law enforcement and corrections officers. That sense that this is such a difficult environment for law enforcement in general, that the idea of recruiting and retaining our existing qualified law enforcement officers could really begin to have a risk management impact for public entity members. Now that's a long list of considerations and influences for pools and their public entity members when it comes to those liability losses and that legal landscape. But I do want to spend just a minute talking about how pools are responding in this environment. So I talked about the increasing specialization of bringing claims of plaintiff attorney firms, for instance, but there's also increasing specialization when it comes to defense and litigation work. Similar to how pools responded to land use claims or employment claims using specialized litigation defense, we're seeing now some of that same sort of specialization come into play, in particular for SAM claims and for law enforcement defense work. So looking to really hire specialized legal resources who are trained in this area, who are anticipatory of the kinds of plaintiff arguments that they might see, and who are really thinking critically about how to respond. Similarly, in that litigation work, we see that there's some specialization that pools are bringing to bear in claims work as well. So really assigning certain claims staff trained or mindful of a certain kind of claim, how to deal with claimants, how to manage claims effectively, making those assignments to that specialized claim staff, again, for things like SAM claims or law enforcement claims, and for cyber claims as well. We also see this addition of really focused and much shorter risk management training than we have in the past. And again, related to SAM, related to cyber, related to law enforcement. So we're seeing really narrow topical focus that pools are putting on their risk management or loss control efforts. And we're seeing delivery of that training, of that loss control advice in much shorter snippets. So hearing from lots of pools who are talking about doing 10-minute training videos instead of an hour-long class that they used to host, or 5-minute daily training updates on an issue that is particularly important for their members to learn. And then finally, we're seeing, in particular in the area of cyber services, some pools begin to explore something more than training, something more than risk management advice, or something more than a newsletter and an hour-long training session. What we're seeing are some pools beginning to really dive into cybersecurity services. So things like conducting system scans or audits or assessments of public entity cyber resources, cybersecurity network resources. We're seeing in some cases pools looking to begin monitoring their member networks, monitoring those networks for intrusions, providing that first stop service for member public entities when it comes to cyber protections, and really helping their members improve that network security. Again, knowing that those cyber claims can be exponential in terms of when they come in and what they cost. Some pools are really looking differently at making a risk management investment directly into their member public entity security and cyber networks. When we talk about workers' compensation right now, it's really all about presumptions. What we're seeing in the public entity space on the whole is just an opening and an expansion of presumptions, workers' compensation, presumed injuries. And we're seeing that expand both in terms of the public entity employees who are covered. So maybe it was firefighters and police, but now it's also all first responders, it's school teachers, It's other administrators working in a building, for instance. So we're seeing those work comp presumptions expand in terms of role, also expand in terms of conditions. So the heart and lung presumptions were the first to come, but then maybe we had cancer, and now we've got PTSD, and then certainly more recently we've had those COVID-19 presumptions. In fact, there's a skin cancer presumption that's being debated now in one state. So those continued expansion of, who might be covered under a presumption, what are the conditions that are covered under a presumption, what are the specific work comp statutory language and provisions of a presumption, and how does it impact a given population within a given pool? Really a lot of question marks, and it is a very, very individualized pool experience, right? Because how a presumption law affects you really depends on who's in your membership, how that law is written, whether it is rebuttable. All of those different factors come into play. When it comes to PTSD and COVID-19 presumptions in particular, these are both really new and emerging areas to watch, because we don't really know. We don't have any claims experience. We don't have any claims history to look to in order to project the total number or cost of those claims. In PTSD, we don't have great statistics about the number of public safety personnel who might be impacted, about the total cost of those claims, about how many of them may file under the work comp presumption. When it comes to COVID-19, there are just so many unknowns, right? What are those long hauler expenses? Is there kind of a reverb effect a year or two or five down the road? There are so many questions about those COVID-19 presumptions and what the ultimate costs might be. It's having a real big question mark sort of influence within this workers' compensation public entity pooling industry right now. Similar to the unknowns that I mentioned when it comes to COVID-19 and workers' compensation presumptions, there's a big question mark when it comes to COVID-19 claims in the employee benefit programs that pools may offer. Now, we did see sort of this different sort of claims dynamic in 2020, where because medical care wasn't being provided the same way, we weren't doing the same surgeries, et cetera, we had this drop off in the number of claims. It may have been offset somewhat by some COVID-19 testing or other kinds of claims, but now there's been a rebound. And part of the question is there a rebound, or is there a rebound plus post COVID-19 when it comes to those claims against healthcare providers? Always in this space, we talk about pharmaceutical benefits, utilization, and expense. Those pharmacy costs are increasing at a greater rate than all other medical treatment costs, and utilization of those benefits is increasing as well. So we spend a fair amount of time talking about specialty use drugs. The formularies for specialty use drugs have been broadening, so there are more of them now than there used to be. The expense of them is greater than it used to be. The conditions for which those specialty drugs are being prescribed for are expanding. So there's lots of influences in pharmacy utilization and expense, and it's a primary driving factor for most of our pools today. We also have mental health impacts. And so we know that there are, again, very similar to workers' comp and PTSD presumption conversations, we know that there are many, many mental health influences that are impacting the population right now. Some of that is COVID-19 driven, but some of that existed even prior to COVID-19. So it's sort of incremental or additive in its nature. And so looking at the direct and indirect impacts of mental health concerns on employee healthcare and employee benefits. That might mean not just the costs of providing mental health itself, but also the secondary costs where mental health is another consideration alongside some other disease or some other condition. And then in the industry right now, I point to health equity considerations. COVID-19 certainly called this out even more dramatically, but public entity pools looking for new ways to make sure that the services they're providing, the benefits that they're providing are equitable among all different gender, race, and other backgrounds. So looking to see, are we giving plan designs? Are we making plan design decisions that are equitable for all of our public entity employees and their dependents? So aside from all of those claim and loss areas and all of those claim and loss trends and the reinsurance trends that I just talked about, there are some other operational realities that many pools today are facing. This is all pools, all coverage lines, right? It doesn't matter where you are. It doesn't matter what kind of coverage you're offering. It doesn't matter who your members are. These are things that are probably influencing your operations as well. And the first is just public entity fiscal conditions. Coming off of the pandemic year, when many public entities, didn't get to stop providing services, didn't get to send all of their employees home, had to make different sorts of accommodations for all sorts of public services. We don't know exactly yet what the longer term impact of the last 18 months are going to have on public entity fiscal conditions, not to mention, the economic impact of the pandemic as well. So really a big question mark for a lot of public entity pools, asking the question, what's the investment in infrastructure going to look like? What is the tax base going to look like for our public entities? Are they going to be able to provide the same kind of services? Are they going to face fiscal constraints that may in turn have a risk management impact or a claim impact or contribution impact on the pool as a whole among all of their members? Recruiting and retaining pool staff, we at AGRiP, we have a job board for our members. We have a long list of job openings on that job board every single week, more job openings than I think certainly I've ever seen in 25 years in this industry. So recruiting pool staff, retaining pool staff, we have had historically a bit of an older employee population, many of whom now are retiring or getting ready to retire. So we really see that recruitment and retention of staff is going to be a primary consideration for pools in the next, say, 1 to 5 years, most certainly. And then correspondingly, at the same time, we see that change at the staff level. We're also seeing it change at the pool governance level. So the elected and appointed local government officials who are serving on the pool governing body, maybe they're not seeking re-election, maybe they're retiring, maybe they're making career choices post-pandemic like many other people are. And so what we're seeing is that not only are the pool staff turning over, but also the governing body members of a pool are turning over as well. And so that's a big consideration, because for many pools, they're facing their biggest governance shift since inception, and they're having to train new governing body members maybe more actively than they ever had to in the past. I always like to close this kind of industry update conversation with a simple reminder about what it is that we are here to accomplish. When we talk about public entity risk pools, we talk about their mission, their purpose, the reason for being, right? And the number one reason for pools to exist is to really enable the local public entities that they serve to do their work, whether that's a school population, a city population, townships, whatever it might be. The pool exists in order to just clear the path, clear the way, to let that local public entity do the work that it needs to do. Now, by doing that, by providing those public entities with the coverage that they need, one of the most important services that pools provide is stability in costs long-term, so that those public entities don't face big swings up and down in their contributions or in their retentions. That smoothing role that pools have is really, really important to the stability of their local public entity members. And one of the ways that we do that as pools, we get to that long-term cost control, is by working to really bend the cost curve. And what I mean by that is identify those risk management resources that are going to help public entities from ever having a claim in the first place, right? The most effective way that we can stabilize costs over time is by avoiding a claim in the first place. Now, for those of you who might be newer to the public entity pooling environment, this Time magazine cover is a real thing. We say oftentimes that pools have evolved from necessity to innovation. And this is the necessity that we're talking about, this March 1986 cover, when pools really began to take shape and take form across the United States as well as Canada. So that innovation that we have today, these core values on this slide, It's really important in today's environment, especially. It's an important reminder of why pools exist. I want to tell you just briefly about where the information I shared came from. We know that public entity pooling is a jurisdictional specific environment, meaning you are in your state or your province, you're governed in your according to your own statutes, according to the way that your own state says you are structured. So that means that there's no single reporting source for the number or nature of pools or for all of the different issues that they face. AGRiP is really the organization that's in the best position to provide that perspective of what's happening across the industry, because our members come from virtually every state in the US, many provinces in Canada, with members in Australia as well. In the US alone, we estimate that there are about 400 to 450 pools. Many of those pools are very small. There are 93,000 local taxing jurisdictions in the United States alone. And we estimate that 80% or more of those local taxing jurisdictions buy one or more of their coverages through one of our AGRiP member pools. And we have about 220 pools out of that 450. The contributions, the net position, the total assets that you see listed on this slide, those are estimates based upon just our members, again, about 220 pools. So the estimate in this, the amount that is listed here in this slide is really the baseline amount. We would estimate contributions, net position, and total assets actually even higher than what's listed here on this slide. Again, our members represent an estimated 75,000 local public entities in the US alone. That's about 80% of the entire universe of cities, schools, counties, special districts in the states and provinces that are indicated here.